In this episode, let's take a look at some of the most extreme and disturbing experiments that took place in mental hospitals throughout history. These are 10 of the creepiest experiments that left lasting physical and emotional scars on patients. 1. LSD experiments, MK Ultra program. Between the 1952nd and 62nd, the CIA ran the MK Ultra program, where they conducted a series of LSD experiments on patients. The aim was to study how LSD affected the human brain and whether it could be used to control minds. Some patients were injected with LSD without their consent, causing them serious mental and emotional trauma. 2. Electroconvulsive therapy, ECT. Electroconvulsive therapy, ECT, involves using electric currents to stimulate the brain to treat mental illness. However, many mental hospitals used this treatment without full explanation or consent, leading to severe mental trauma. ECT can cause long-term memory loss, cognitive impairments, and emotional problems, causing great pain to many patients. 3. Brain surgery, psychosurgery. In the mid-20th century, mental hospitals performed extreme brain surgeries, like lobotomies and prefrontal lobotomies, usually to treat mental illnesses or violent behavior. By removing parts of the brain, doctors believed they could control emotions and behavior, but these surgeries often led to drastic changes in personality and cognition, and some patients were left in a vegetative state. 4. Hypnosis experiments. Some mental hospitals conducted hypnosis experiments in an attempt to control patients' behaviors and thought. Under hypnosis, patients became highly suggestible and were sometimes forced to do things they normally wouldn't. These experiments were often done without the patient's consent and could have long-lasting psychological effects. 5. Sensory deprivation experiments. In these experiments, patients were isolated in completely dark, quiet rooms with no external sensory stimulation. The lack of sensory input led patients to experience hallucinations, panic attacks, and mental breakdowns, and in some extreme cases, even caused dissociation of their personality. Though seen as a psychological experiment, the results were disastrous. 6. Sleep deprivation experiments. Some experiments required patients to stay awake for long periods, completely depriving them of sleep. Since sleep is crucial for both mental and physical health, prolonged sleep deprivation led to severe anxiety, mental confusion, and even hallucinations. These experiments were incredibly cruel, and many patients couldn't recover afterward. 7. Drug experiments. Many mental hospitals tested experimental drugs that hadn't undergone proper clinical trials. Patients were often forced to take these drugs, enduring the severe side effects. Some of these drugs caused mental confusion, depression, anxiety, and intense physical pain. Many patients never fully recovered after prolonged use of these drugs. 8. Group isolation experiments. In certain experiments, patients were deliberately isolated in small groups with little to no contact with the outside world. The goal was to test group dynamics and psychological pressure, but it led to extreme mental breakdowns from isolation and oppression. This type of experiment had long-lasting negative effects on patients' mental health. 9. Fear response experiments. These experiments were designed to create highly fearful situations to test how patients would react. Patients were intentionally exposed to terrifying situations, triggering intense fear responses. Long-term exposure to these conditions often led to post-traumatic stress disorder, PTSD, which could permanently affect their mental health. 10. Mind control experiments. Some mental hospitals attempted to control patients' thoughts and behaviors through extreme psychological methods. These experiments included intense behavior training, forcing patients to accept specific thought patterns or beliefs, and using psychological pressure to make patients change their cognitive behaviors. These experiments not only violated patients' free will, but also caused irreparable harm to their mental health. These experiments highlight the darker side of medical and psychological research in history. While some of these experiments were aimed at scientific progress, the pain and suffering of these patients were often overlooked, leaving them with indelible emotional scars. These experiments not only harmed the physical and mental well-being of individuals, but also raised serious ethical and moral questions in society.